Hi, I'm Dr. Mark Hollmann, Florida Orthopaedic Associates. I want to take a minute to answer some questions we've had from some of our patients. This one is, what is an artificial knee and how does it stay in place? That's a great question. An artificial knee is basically a resurfacing. A lot of my patients think that we just take a whole knee out, we've got a shelf of knee replacements on the board, and we kind of look and we put in an entire knee. That's not it at all. Basically a knee replacement, and I've got a model here for that, is just a new resurfacing. It's a metal surface on the edge of the femur and the top of the tibia, and then it keeps all of your own ligaments. So basically it's really, when it's called knee replacement, it's more knee resurfacing. The technology has been out for almost 30 years now. We have about 85% survivability at 30 years, so we know the long term of this is a good operation. In fact, Harvard, I believe it's Health Review, named joint replacement one of the top 10 medical advances in the last 100 years. So it's been a very successful operation and it works quite well. Typically these are held into place with bone cement, or we're using some press fit type materials where it's kind of a gritty surface on the prosthesis. I'm typically using that on my younger patients.